Today I am sharing with you a case who had a long-standing ischemic heart disease, and he also has had renal failure, and he is on hemodialysis. Long-standing diabetes since 2010 and high blood pressure made him undergo angioplasty in 2012, and over last 10 years or so his kidney started failing because of the long-standing diabetes and hypertension and low hemoglobin. So ultimately his serum creatinine started rising, and in 2016 onwards he was requiring hemodialysis. He was on a regular hemodialysis. Recently, when he again started getting angina, he underwent coronary angiography, and angiography showed that stents are blocked and he has had new disease coming up in his coronary arteries. So he had to undergo coronary artery bypass surgery. So because of triple vessel disease occurring in this patient, he was advised coronary artery bypass surgery. This subset of the patients, those who have had stenting for their coronary artery blocks and those who are already on hemodialysis, are special subsets, and they are complicated, complex patients. Because of they are on hemodialysis, their biochemical parameters are deranged, they are usually anemic, and they have their renal functions which are abnormal. So when we decide about coronary artery bypass surgery in these patients, we have to take special preparation, special precautions, and special protocols to let them undergo successful coronary artery bypass surgery. I have a long series of such patients, those who underwent coronary artery bypass surgery with dialysis. There is a special protocol which I follow, and so that they can undergo safe and successful coronary artery bypass surgery. My protocols are a little different from other surgical units. Usually it has been advised that these patients will not be able to tolerate on-pump surgery, and they should be given off-pump procedure. But in my experience of 25-30 years, where I have done a large number of these cases, those who are on hemodialysis, my protocol is that I do them on pump. I make their, before surgery, I make their all biochemical parameters normal. Usually these patients undergo hemodialysis one day prior to surgery. And on pump, I usually use dialyzer, so that the whatever next 2 days of post-operative period are safe and they are extubated, and then again they can undergo hemodialysis. At the same time, I use Swan-Ganz catheter so that we monitor hemodynamic status, fluid requirement, and at the same time repeated potassium serum electrolyte measurements are also done. And I found that dialyzer while on pump and is very safe and very useful, so that we do total vascularization of all the blocks needed to be bypassed. And at the same time, if required, we also use the any blood products which are required, so that their hemoglobin is about 10 gram, and at the same time they are washed out via dialyzer during cardiopulmonary bypass. And it has been very successful series where I have not lost any single patient, and they are very hemodynamically very stable, renal functions parameter wise very stable, and they can, if they are extubated next day, they can also undergo hemodialysis within next 24 hours or so if required. Normally dialyzer is capable of making them renally independent for next 24 to 36 hours, so that fluid requirement is not there, and they can undergo safe post-operative recovery within for next 24 hours. And it has been a very successful series where I do these cases on pump and with the use of dialyzer. And it is my advice that on-pump surgery is very safe in especially in chronic renal failure patients, those who are on hemodialysis. And it has been my endeavor to give them a good protocol-based treatment so that surgery is done successfully and they enjoy a good long-term result of coronary bypass surgery. Thank you.